Dear students, we'll discuss a clinical condition today, case scenario probably, wherein very common it is, especially in South India, is oral carcinoma that is related to the lip. Carcinoma lip, just see what this condition is. Look at here, see that oral cavity you can see here. You can see the proliferative lesion in the everted edge. See that nodules, you can see that, and it is going inside. See that? That is going inside also. If you carefully examine this patient, it's going inside. Now you can see the pigmentation there that gives a differential diagnosis to think actually. So different diagnosis here you have to think of is mainly melanoma also, pigmented melanoma also. Second thing, pigmented carcinoma also can be. Third thing is pigmented BCC also. This is the differential you have to think of. First diagnosis is always carcinoma lip. That is the commonest thing. So melanoma and BCC you have to think of as a differential diagnosis. Oral cavity you have to examine, buccal mucosa, flora of the mouth, tongue, palate, everything. Lymph nodes examination important. Level 1A, 1B, 2, 3, 4, 5. Then afterwards, mandible examination is important by digital palpation. That's important. One finger inside, one finger outside. Look for thickening, tenderness, irregularity, fracture site. Thickening, tenderness, irregularity, fracture site. These 4 points you have to look for. And systemic examination, especially lungs, because usually they are local regional disease, unlikely to have a systemic mets as such. So that is the carcinoma, very commonly kept short case in the exam. Viva they will ask, oxy they will keep, and clinical case they will keep, and theory also they may ask. It's not uncommon condition. So you have to do biopsy, wedge biopsy from the edge, 2 sides you have to take, confirm it is common cell carcinoma. Then you do X-ray, orthopentamogram X-ray of the mandible, which I had a lecture earlier. You can always go through the orthopentamogram lecture of mine earlier, and then do a CT scan neck and head and neck region, and ultrasound neck for lymph nodes, but mainly CT if you do sufficient, everything gives the idea, local spread, soft tissues, lymph nodes, mandible involvement, everything it gives a detailed idea. Once you do that, then plan the treatment. So in this patient, give a neoadjuvant therapy initially, probably chemotherapy and radiotherapy. Once it shrinks adequately, do a wide local excision, then lymph node dissection, probably modified radical neck dissection. Depending on the situation, you retain whatever it is. Spinal accessory node is always retained. And then after that, you add on to chemotherapy, radiotherapy, depending on the number of lymph nodes involved, stage, everything. So basic thing here, because it's not very early, it's a locally advanced disease. Initially, neoadjuvant therapy. Then reassess the patient after 3 cycles. Maybe add on to the radiotherapy. Then after that, do a wide local excision. Reconstruction is important. Different reconstruction methods are there. Maybe free flaps, that is very popular now. There are enough reconstruction surgeons are there, they will do a very good job. The neck dissection is very important again, and further chemotherapy is also important as a adjuvant therapy. Then regular follow-up to prevent recurrence, relapse, and whatever it is. So that is the basic thing you have to remember. Squamous cell carcinoma, the first thing you have to think of. Everted edge, you look at that. Nodules, look at that. So all those things are clear. So proper clinical examination is important. For that, to go through my clinical methods in surgery, you got a video, oral cavity examination in detail it is there, and neck also you can go through the examination. Now neck lymph nodes are examined, lymphatic system examination also. It can give a detail how exactly you will examine the neck lymph nodes. Then you can go through my manual of surgery, oral cavity details. It gives a very detailed explanation with the diagrams, management policies, concepts behind carcinoma lip, that is squamous cell carcinoma. We'll just go through the slide now. I already told melanoma, pigmented BCCR, the differential diagnosis, lymph node levels, and FNEC of the lymph node can be done. 90% occurs in the lower lip, upper lip BCC is common. Wedge biopsy from the edge, ultrasound neck, nodes, CCT, all those things I have told. Wide local excision, reconstruction, MRND, that is modified radical neck dissection. Then after neoadjuvant therapy, then continuation with the chemotherapy. There is a treatment modality is required in this patient. So every patient is different because stage is different, grading is different, planning is different. So each patient have an individual idea. Planning you should have with the backup of proper theoretical and guideline knowledge about subject. So for that, you should have a proper clinical equipment and analysis and assessment. So that's why I go through my clinical methods and surgery in detail, and also go through my manual, SRB's manual of surgery for whatever topic, especially oral malignancy, so that you get a very good idea how exactly approach for individual case basis, case scenarios one by one. So students, answer this MCQ. So put it in the comment box. I will go through the comment box. I will acknowledge your answer, and I will give the reasonable explanation for the answer also. So please try all MCQs regularly, whatever coming in my lectures. Meantime, I request everybody to subscribe my YouTube channel, which is free and which is very, very informative and educative also. So again, another MCQ. Among below these, more potentially malignant lesion is A, B, C, D. Again, put it in the comment box. I will acknowledge you definitely, and I request all of you to subscribe my website so that you will have a regular idea about the different topics and subjects on day-to-day, daily basis. Student, please go through the quotation of the day. Nobody has the power to take two steps together. You can only take one step at a time. This is a very important quotation for your life. So students, please go through my SRB's clinical methods in surgery, current edition, which gives in detail about the clinical exams, all chapters, including X-rays, other images, basic instruments, specimens, and gives a very lot of photographs are there, figures, illustrations are there for your benefit. Detailed clinical methods and case sheet rating is there. That's very important for clinical surgery. And manual of surgery, current edition, gives a detailed discussion of all topics, specialties, urology, cardiothoracic, and other chapters, including instruments, operative surgery specimens, as per CBMA syllabus in detail for your knowledge, exam, theory, clinicals, everything. Please go through that. And of course, my operative surgery book with the 2 volumes, very useful to understand the every operative procedures with the step-by-step technique. And my atlas of tissue approximation, small book with a video. All this contains a video of demonstrations of different things. It also gives a suturing technique very briefly, very nicely, and with the principles. Please kindly go through that. And my SRB surgery insights and YouTube different channels, my website. You can please subscribe. That will give a lot of information, and it will be very, very benefit for all students. And please subscribe my SRB surgery insights of different modalities for understanding better knowledges and subjects, because best topic, different versions are there in small topics in the website, and this is the QR code for the same. So students, I hope you have understood this topic very well. Thank you so much.